Welcome back, everybody, to episode 4 of the Industry Close podcast. We're your hosts, as always. I'm Brian Suter, and with me is Jeff Stotts. Jeff, it's great to be chatting with you again here a little bit earlier than usual.
Yeah, we've got a ton thrown at us early in the week and some fun, exciting stuff happening at the end of the week. So let's get this in early.
Yeah, so we are currently recording this on Wednesday evening, so a couple of days earlier than usual. I'm officially on baby watch, and so we've bumped up the recording a little bit here so that we can get this out this week. And of course, there's been a ton of stuff that's happened in the sports world this week, especially with the NBA. And so I think that's a perfect place to start with, the biggest, kind of injury news that we've had to talk about this past week, which is Chris Rock being, no, I'm kidding. We're not going to talk about Chris Rock like everybody else. Robert Williams, of course. It has been a pretty wild, 48 hours with Celtics fans, especially around the NBA. Jeff, walk us through what's transpired here the past couple of days regarding what has to be one of the hardest things for the media to talk about, this meniscus tear for Robert Williams.
We know it was hard to talk about because I feel like we've talked about it in every episode so far. So this is just kind of layers to this conversation that we've had. But Robert Williams left the game with a knee injury, originally called a knee sprain. You listen to the quotes after the game, they kind of said he was having some sharp, significant pain on the lateral aspect of his knee, so the outside aspect.
And that's important. That sharp pain is something that we pretty typically see, right, with meniscus tears.
Yeah, and because it was a non-contact injury, you're not thinking an LCL sprain or one fell into him, and it's kind of hard to sprain the LCL and that outside ligament. It's just not a common motion that we usually have occur in sports. So instantly I'm thinking meniscus. Is this meniscus? And you could just kind of tell the overall mood was this was something significant. It wasn't just something they were hoping he's going to be back in a couple days. Then we find out it is a meniscus tear, and then it was like, all right, so what are we going to do next? And there was some fear he would be lost for the season. Can he come back during the playoffs? And then finally this morning we got word he underwent surgery. It was a meniscectomy for a partial tear, so a partial meniscectomy, and he's expected to be back in hopefully 4 to 6 weeks. They'll probably keep that timeline very fluid based on how the knee responds to everything. But through all this, we find out we know the type of surgery he has, but then it gets interesting because this is where you and I get frustrated, is the reporting of the injury. And I'll let you dive into that a little bit.
Oh man, extremely frustrating. And that's the word of the day for everybody is meniscectomy. Sometimes I say meniscectomy, you'll hear people say meniscectomy, but essentially it's two words put together, right? It's the menisc for meniscus, and then the ectomy is just fancy medical talk that makes us feel smarter. That means removal or resection. Backing up a little bit with this whole thing, you mentioned the vibe kind of around the team initially after this occurred. And we've been around this long enough to know kind of when you start to hear those early reports, especially when somebody has a bad ligament injury, right? You'll start to see that report of, team has fear that there's been a major knee injury. And we know from the physical exam maneuvers that you can perform that your exam is pretty good at picking up some of these acute injuries, whether it's your Achilles ruptures, like we'll talk about later on in the podcast with Justin Moore, your ACL tears. We're pretty good at our physical exam. And so that medical staff has a pretty good sense within the first 15, 20 minutes what at least is at the top of their differential. And so you can kind of sometimes read between the tea leaves a little bit about what happened. And I'll say, you mentioned that sharp pain. Actually, of all of these different physical exam maneuvers we do, joint line pain is actually one of the most sensitive physical exam tests. We have all these other maneuvers we can twist the knee through. You might hear about something called a McMurray's sign or McMurray's test. But actually just sharp pain on the joint line is one of the best ways ahead of time to be worried about a meniscus tear. And especially in a young player who shouldn't have arthritis in their knee, there's not much else that's going to cause sharp midline kind of joint line pain. And so right away, I'm sure they did have a pretty good sense of what was going on. Also, the knee swells pretty quickly, right? So we talk about immediately if you have swelling. So that first 30 minutes, that first couple of hours, that's when we worry more about like the ligament injuries. But if you have more delayed swelling, like say Williams wakes up the next day and the knee is swollen, that's a little bit more suggestive of the meniscus tear. So even before we get to the MRI scanner, we've got a pretty good sense in terms of what we're looking for on the MRI scanner that we can tell the radiologist, hey, look here, look at this. So that takes us to a lot of the initial conversation here in that first 24 hours, which was, boy, is he going to need a surgery? What's the type of surgery going to be? Walk us through a little bit the different approaches to surgically treating the meniscus, whether you decide you need surgery or don't need surgery. What are some of those things that we're looking for in the reports and that we hear about that actually influence these decisions?
So you got to understand the shape of the meniscus a little bit. So those shock absorber pads sit in the middle of on your joint line, like you were talking about, and they act as a shock absorber for your knee. And when I was learning about meniscus tears, someone once told me it's like real estate. It's all about location, location, location. And basically, the location is going to dictate what their surgical options are. If it's on the periphery of the disc, a lot of times it's just easier to just shave that off, take it out, remove the piece, whatever you want to do, whatever the approach is. And that's back to what you said, the meniscectomy, where we're talking about taking that piece out. If it's in a specific location, that's really helpful for a repair, because then it can get repaired where they can suture it down, repair the site, that generally in the area that has good blood flow. But again, it's got to be in a very specific way. It also, the pattern of the tear matters. So sometimes you get what we call like a bucket handle tear, where it kind of folds over on itself. Those are more difficult to repair. And so again, for a true repair, like we've seen in the NBA with Jaren Jackson Jr. and a couple other guys, it has to be in that specific location. If it's not, it's not even an option. So while we were trying to have this debate on, is he going to have a repair? What's a removal? What's going to be the best thing for him long term? It really doesn't matter until we get into the knee and take a look and like specifically pinpoint where this tear is. And if it's in a good spot, let's have the repair. And if it's not, let's just excise that damaged tissue, move on, and begin the rehab process.
Yeah, 100%. Oftentimes we'll see patients in clinic or athletes and we'll show them their MRI and say, well, boy, ideally we want to repair this, right? The medical staff is thinking long-term about the health of the player. They're not there to be talking about winning championships. They're there for the long-term health of the player, which is another point we'll get into here in a bit. But oftentimes you're right. You don't know. I mean, there's some meniscus tear patterns that are very clearly degenerative in nature. They're complex. We know we're not going to be able to do a repair. And so we have pretty good guidance ahead of time for the patient of what to expect in the post-op rehab. But a lot of times with these tears, you really don't know until you actually get in there with the scopes, you visualize the tear, you see how mobile the tear is, you look at the surrounding meniscus by that tear. And so even if we would have had a direct interview with the surgeon, he would have told us, I don't know. Until I get in there and actually look at the knee, I don't know what we're going to do. We're going to try to save as much meniscus tissue as we can, but I don't know until we get in there. And so that kind of brings us now to today. We get the update that he's undergone a partial meniscectomy, so a trim, a resection, whatever word you want to use, but not a repair. This frustrated me so much. I see Adrian Wojnarowski, one of the biggest NBA reporters out there, and the headline across ESPN says, Robert Williams undergoes surgery to repair meniscus. And I just, like, my head goes into my hands, because that's not the case, right? He didn't have a repair. He had a resection, which now is, I guess, good news, right, for the Celtics in the short term. What do you think, recovery wise, what are we looking at here in terms of when we might see him back for the postseason?
Average return to play is about 6 weeks. So looking through the collective data that I have, based on his position, it kind of changes some things a little bit. The fact that it was a lateral meniscus versus medial meniscus does play a part in here due to the amount of weight bearing through the joint. But the good news is with that, it's kind of like taking a rock out of your shoe. Once it's gone, it's gone. And you can feel better. You got to treat the associated symptoms, do some things to prep the knee, regarding range of motion, strength, those kinds of things. But then once he can get back and play, he can get back and play. Now, his long-term risk does become elevated for certain things. The chances of a secondary tear do go up. And long-term, with that tissue gone, he is at risk for something like osteoarthritis down the road. But we've had plenty of guys come back from meniscus injuries and be just fine and be successful and return to play at a high level. So the fact that it's going to be measured in weeks, not months, is good for the Celtics this year and probably for the next several years as well. He'll go into the offseason with a plan on what to do, and they just have to execute.
Yeah. And that long term risk, it's not something people were asking me on Twitter after I talked about that, well, is it going to be like next year? Is it going to be in 6 months? No, I mean, this kind of development of arthritis that doesn't always happen down the road. This is like many years down the road sort of thing. But there's so many unknowns. It's hard to know what that risk is, right? We have no idea. I mean, your meniscus is not a you have it or you don't. And so this tear could have been the tiniest little, like, minuscule little flap that was there, to where if you grossly looked at it, you don't even know what they took out. And that's one kind of misconception that I hear a lot. I'll say is, I will credit, I think we've gotten better in the greater media landscape of understanding the difference between a repair and a removal, or a repair and a trim. But there still is this big disconnect into what a trim or removal means. I think some people interpret it as they just took the whole meniscus out. Like, they just go in there and just pulled out the entire meniscus, which is not at all what they do. If they go in there and they trim away that piece that's torn, it's kind of like a little hangnail, right? You got a little hangnail in the back that you just want to get rid of that little spot that's causing irritation, and you want to save as much as you can. And so that long-term risk is really dependent on where was the tear, how much was taken out, tons and tons of other factors that there's really no way to fully predict and understand the risk of. I think if we do a quick little physics lesson here to understand the meniscus, you mentioned it's kind of that C-shaped cushion that sits inside the knee. And going back to physics, we know that pressure is the force over the area. So if you have the same force, so the same body weight going through somebody's knee, what the meniscus does is it covers sort of the contour of the joint to increase the surface area that is distributing that force from the player's body weight. If you remove that meniscus, now if you imagine like putting two basketballs together, you've got contact at just that single focal point. So now you've got the same amount of force going through a smaller area, which increases the contact pressure. So by maintaining as much of that contoured meniscus as you can, you distribute the force throughout the knee so that you have lower contact pressure, and that lower contact pressure hopefully helps to stave off things like arthritis. So quick physics lesson. You guys didn't know you were going to hear a physics lesson on a sports podcast today. But, I think this is all, we harp on this type of stuff a lot, but to me, at least, it's really important. I know to you as well, Jeff, you're seeing athletes in the training room, and these athletes have these injuries. They have meniscus tears, and they read a report that says, well, Robert Williams came back from his meniscus tear repair in 4 weeks. So, like, why are you telling me that I'm going to be out for 6 months and my season is over? So I know we sound like broken records. I know we harp on these things a lot, but I think it really is important to have consistent, accurate messaging, because fans are absorbing this stuff, and fans become patients who look to these players and relate to these stories. And so that's really our whole goal here when we talk about this, and why we stress these things so much. Agree?
Yeah, and kudos to the Celtics for their press release. I mean, it was very specific, very transparent, which is so nice to see, because it makes us, the interpreters of that information to the fan, significantly easier. It makes our job a lot easier. It makes the fans understand what's going on a little bit better. And it does provide a lot of clarity to what was, like we discussed, a very murky situation there for about 48 hours.
Yeah, and I will say, too, for Celtics fans, you have to have confidence and faith that the team doctors did everything possible thinking about his long-term health. I know there's been some thought, well, like, they were told to trim it out so that he could be back for the playoffs. No, get all that conversation out of here. If they got in there and thought that it could be repaired and that was best for his long-term health, they would have tried to repair it. Clearly, when they got in there and saw it, they knew that wasn't going to be an option for long-term sake. And so they did the next best thing. And here we are. I saw a report too, Ime Udoka mentioned that he's going to be hitting the ground running tomorrow, like 2-a-days, getting right back at it. What is the next kind of couple of weeks to getting back to that return look like for Williams coming off of this type of surgery, in terms of what, he's going to be doing right away, what kind of steps he has to go through before he can hopefully be back early enough in the playoffs?
So first one is always, you want to make sure you minimize any potential risk of infection. Just cleaning up, even if it's a small port site or a small incision, making sure that that's healthy and clean and stays clean. And then you're addressing those initial symptoms. You're addressing the swelling, his pain level, depending on, how comfortable he is. And once you start to see that stuff go down and he's comfortable, you got to stress range of motion, especially in the knee. We're looking at getting full extension, full flexion in that knee, gradual weight bearing to get him back, and then strengthening the knee. So,
Yeah.
and it's just progressive. And then heading it back to sport specific treatment options and things doing so that, like you said, his knee is ready to bear that force with jumping and dunking and blocking and all the things that he does well.
Well, all things considered, it's for the sake of the Celtics season this year, it sounds like for Robert Williams' health's sake as well, this is as good of a scenario as we could have predicted, and hopefully he makes a quick recovery and is back out there for an exciting playoffs. Sticking around in the NBA, just honestly, as we were about to record this podcast, I get tagged in a notification on Twitter, video of Steph Curry tonight walking into the arena wearing a walking boot. Now, we're close to the point where Curry's about to be reevaluated. It's been almost 2 weeks, I think, from when he had this foot sprain. We saw some previous pictures of him without the boot on. Obviously, Twitter's going to go wild here. Is this a setback? What's the deal? I don't know if you've seen this video yet, Jeff, but just hearing that we see Curry in a walking boot now, what do you think about that whole situation?
So it's likely they want to reduce the amount of weight being placed through the foot. The good news is he's not on crutches. We tend to use a boot. I'm kind of overkill with boot. Like use it until you feel like you don't need it anymore. I always say, when any of my athletes want to get out of their boot, I say, great, you got to carry it around for a day too. So if you start to get some soreness or some pain in that foot, put it back on, take it off, and then you can go back to wearing your normal shoes.
I like that
and those
idea.
kinds of things.
Yeah, I like that.
Yeah,
Make them carry it around for a day.
Yeah. And so they, if it really will show you how bad they don't want to wear that. If they're willing to carry it around, that means the foot feels pretty good or the ankle feels pretty good. And then, he does have a history of other ankle issues too. So it could very well be that he was progressed to a certain aspect of rehab, and then afterwards it was sore. And so instead of running any risk of anything else, they put him in the short boot for ambulating purposes, just to walk around so he could get around without putting any additional stress through that area. I wouldn't panic just yet. It's obviously not where we would like to be in terms of we had hoped he would progress past needing a boot. But again, at the same time, there's still some ambiguity to the situation that it's hard to freak out.
I will say for sure one takeaway from it, there's a difference between a short walking boot or a tall walking boot, and it's literally as simple as it sounds. One of them is shorter, like lower down to the ground, and the other comes closer up to the knee. And typically we use a taller walking boot for more ankle injuries, and we'll use a short walking boot more for the foot. And so the fact that it's at least a short boot, I think says, okay, there's not like some new secondary thing that happened, like he sprained his ankle during rehab, and so now he's in like a tall boot. I think that at least looks like status quo. The unknown here, right, is those previous pictures, the photo ops we saw whenever the college teams were in town for March Madness. He might have just taken his boot off for those photo opportunities, and he had been in it, the other 23 and a half hours of the day. So that's the big unknown here. I think the bigger thing is how realistic it is for somebody to progress from being in a walking boot to playing at an NBA playoff level in the span of 2 weeks. And that's kind of where things get to be a little bit concerning timeline-wise. Maybe that reevaluation period was, okay, 2 weeks in a boot, and then we're going to reevaluate you in 2 weeks, and this is all going to plan. So there's some unknowns here. It obviously would be nice to have seen him walking around without it by now. But I think until we hear differently, there's no reason for people to panic. I mean, these teams have plans. They know what they're doing. So to be determined, kind of more information I'm sure will come by the time we get this out there. So if we find out tomorrow morning that something is totally different and there's been some sort of setback or updates, don't hold it against us, because as you guys know, we don't always have everything immediately in real time here. Sticking in the NBA, a couple of updates with the Lakers. Of course, we've talked about Anthony Davis a lot. Everybody thinks this podcast is named after Anthony Davis, which we can assure you it's not. That all came after Jeff decided to name his site and everything that. But a little bit of concern here with LeBron James, the Iron Man who gets down, he sprains his ankle, ties his shoes a little bit tighter and gets back out there. Maybe a little bit of concern here. What are we thinking? Are you worried about this? Is this just kind of par for the course? It's, time's ticking here for the Lakers.
That's kind of the go-to mantra right now for all these injuries. The clock is ticking, because for teams that are still in the postseason race, they're running out of time, whether that's to get seeding or actually get into the postseason, like the Lakers are fighting off the Spurs and those kinds of things. They need LeBron out there. But he left the team today to go back to LA to work on the ankle. The thing that I've heard that has got me a little bit concerned is the amount of swelling. It sounds to me like there's just some persistent swelling around that ankle. To hear a guy like LeBron, who generally doesn't talk much about his injuries, say the ankle felt horrible after he did it, and then for him to just already be ruled out for multiple games, is frustrating for Lakers fans, because they are fighting for their lives and their playoff lives, and it really is just sounds to me like it's a mild, but maybe more mild to moderate sprain.
Yeah.
And they're dealing with the associated symptoms of that. And it's, even LeBron is human. So, that's just kind of where we are.
We've seen a definite change in his attitude the last year. I think ever since he had that high ankle sprain, which was the opposite foot, I believe. I think that was his right foot. This was his left foot, which of course is the same side that he's been dealing with this knee. And it's interesting, until people pointed out to me with his left knee, that is the knee that he has jumped off of his entire career. Like, some guys kind of tend to jump off two legs. Some are very much one-legged jumpers. LeBron is almost like 100% one-leg jumper, and he always jumps on that left leg, which who knows how much that's related to all this. Just interesting thing to point out and observe. So this is that same side, right? He's already dealing with some swelling, some pain in that left knee. Now you affect that left ankle. Remember, we talk about that kinetic chain, right? You affect one link in that chain and things upstream, things downstream. The stability in the ankle is not just from those passive ligaments that become sprained or become injured. It's from the dynamic stabilizers. It's from your hip muscles. It's from your quads. It's from your knee. It's from everything upstream that has to be firing and acting appropriately to protect your joints from injury. And so if he's dealing with a sore knee, now he's got a sore ankle, like, these things start to accumulate. And we've seen in the past year or so, he's human. You're right. I mean, this is what tends to happen to players as they age and kind of get towards the end of their career. And there's no reason to run from that conversation. I think he's got a track record of recovering quickly from these types of things. I think the Lakers maybe don't feel as much urgency as we perceive from the outside. It sounds like Anthony Davis is hoping to come back maybe at the end of the week. And so who knows? But you're right. It's definitely concerning. And I think you're right. And what's almost more concerning for me is just to see the attitude change. You don't kind of have that same confidence, that same fire. But I guess, to be determined. He's LeBron, right? So he's going to prove us all wrong, and he's going to come out and he's going to average 40 points in the playoffs and make it to the finals, right? Yeah. Sticking around in LA for a little bit, we saw a really triumphant return the other night of the other town in Los Angeles. I feel like now the Lakers are close to the point where we have to call them the other team in Los Angeles. But of course, Paul George returned to the NBA last night after a pretty unusual injury. We don't typically see these UCL injuries in basketball players. It's notoriously that Tommy John surgery, that Tommy John injury that we see in baseball pitchers. I've actually had Tommy John surgery myself. It was no fun at all. I have a lot of sympathy for what these guys go through. Mine was from playing tennis, though, and I still can't throw 100 miles an hour. So don't believe those myths that if you get your UCL reconstructed, you can throw a really hard fastball, because I can't. But it was great to see him back out there. I got to say, I'd be pretty worried about the Clippers, man. They're looking good. There's rumors out there about Kawhi Leonard coming back. The time frame would fit if he is able to make a return here early in the playoffs. So nice to see George get back out there. Risk going forward, really that ligament gets stressed in a basketball player only from some sort of bad contact. A pitcher who throws all the time, it's going to be stressed with every throw. But unless he gets into some really awkward situation where there's a contact injury, it shouldn't be getting stressed in daily activity. So I would hopefully expect he's kind of out of the woods here, and will do really well going forward. Any other NBA stories to touch on here, Jeff?
Other than the wave of players starting to get ruled out.
Yeah, man, you mentioned this. Yeah, you mentioned this last week, tracking everybody at the end here. What are the numbers showing you in terms of all the guys out and games lost and everything here?
So my buddy Mark Stein and I kind of had we're trying to come up with a good name for it. This day where suddenly everyone starts to get ruled out. We couldn't come up with anything. And I think the day that we were having that discussion, 8 players were finally, I think 8 was the final number. We had some unique injuries, and like Darius Basley, who had a tibial plateau fracture, which is a interesting injury in itself, but it is definitely a season ender. There's no way he would be able to come back. And then other players where you kind of think, okay, this is more of a move to affect the standings or just get the guy some rest to finish out the year, like Eric Gordon in Houston with some of the groin soreness that is shutting him down for the year. So before the game started on Wednesday, we were at just over 6,700 total games lost due to injury. Now that number is extremely elevated by the COVID numbers. Those numbers, COVID protocols and COVID itself account for about 1,300 of those days lost. I mean, just a ton of man games lost. And so those numbers are elevated, but we're already going to be guaranteed, I think, about 300 additional games lost due to the roughly 35 players that are not expected to play again this season. Some of those guys have been already ruled out for the season. I think the number sits at 29, while there's, I think, 5 or 6 players that have been ruled out indefinitely. A guy like a Zion, who we don't really know if he's done for the year, but it seems likely he's done for the year. So we're looking at already accounting for at least 200 plus injuries to add to that total. So we're going to pass the 7,000 mark for the first time ever in my accumulation of data that dates back to the 05-06 season. So we always see a spike here in the last couple weeks in the season as these things start to occur, but it's gonna keep going until the very end, and then I'll give everybody an update on what the final total was and what it looks like, and we can talk more about that once the regular season's done.
We need to plan to do an episode just kind of breaking down some of those numbers after the season's over. I'd be really curious to see the breakdown in some of these trends, if we're seeing more soft tissue injuries with everything happening in COVID. That was the fear initially versus, fractures, just kind of what patterns are we seeing. So that'll be a fascinating discussion to have down the road here. Let's stick in basketball. I got to give a quick shout out, UConn, Paige Bueckers, man. She had a pretty bad injury earlier in the year, and I don't know if any of y'all listening or following women's college basketball. It was a fantastic game the other night between UConn and NC State, I believe it was. It went to double overtime. But, we talk about some of these. We talked last week about Giannis and his hyperextension injury. Paige Bueckers had a similar sort of thing happen earlier in the season, was able to come back, is playing fantastic. I know we don't talk a lot about college athletes kind of in any of our stuff, but it's always really cool to see somebody make a great recovery and now be there leading their team in the postseason.
Yeah, and she had that tibial plateau fracture I mentioned earlier. So unique injury. Not very many NBA examples. Kobe is one of probably the most famous example of a tibial plateau fracture, but it's a difficult injury. It does indirectly/directly involve that meniscus. So, because that's where the meniscus sits. So we can just repeat everything we said earlier and just include the bony aspect of it as well. And so what she's doing is extremely impressive.
The one thing I always wonder when we hear about these tibial plateau fractures, I hear tibial plateau fracture, you probably hear it, and we think big traumatic, like car accident, bones sticking out from one another on an x-ray. But a lot of times when we have hyperextensions or like an ACL tear, you'll kind of have this pivot shift mechanism where you get like really bad bone bruising, right? In the different compartments of the knee. And sometimes that bone bruising is significant enough that they'll actually, on like an MRI report, they'll call it like an impaction fracture. And so I wondered, who knows, but I always wonder when I hear that mention of a tibial plateau fracture, if it was really more of kind of that impaction fracture where you probably wouldn't even see it on x-ray. But if you get an MRI scan, you kind of appreciate the fracture line, which wouldn't be as severe as like a true, bone is cut, displaced sort of thing at the top of the tibia. But yeah, a great story. I don't have a specific women's basketball team that I follow, but it's always nice to see them come back and do well after injuries like that. Sticking around in college basketball, the big, I think, injury news at the Elite Eight, unfortunately, of course, Justin Moore. Was there any real question? We saw the replay on TV of what happened there, and I think everybody instantly was reminded back to Kevin Durant, right, with what happened there with him.
Yeah, and I think everyone kind of knows what to look for now because of KD.
Right.
We're taught one of the first things you hear an athlete say is they feel like someone either hit them in the back with a bat or they kicked them in the leg or something, and you'll see them turn around and look to see like, hey, who kicked me? And Moore kind of did that. He looked behind him in a weird look, and then you see the replay and you see that recoil as the band that is the Achilles ruptures, and it releases that tension and that shockwave up the calf. And you just kind of know. And I guarantee you that Villanova medical staff knew what it was pretty quickly. We have a pretty accurate special test that we can do to perform. And the MRI is really just confirmation at that point. But in regards to Moore and Durant, very cool to hear that Durant reached out to Moore and they had a conversation about what to expect and those kinds of things. So very cool of Katie to give back. So often when I have an athlete that is a really good people person, I kind of make a mental note of that. And I ask down the road, hey, if I have another person come in that's got a similar injury, do you mind if I give them your number, or can I connect y'all? And, because it means so much to somebody that's going through an injury to have someone that's been there, especially if they play a similar sport or they're a similar age, those kinds of things, to give them the heads up of what to expect. Because coming from me, it might not mean much, but if it's coming from a peer, someone that's in their age group, someone that plays a similar sport, it's going to mean a lot more, and it can be so helpful in terms of just getting the athlete over that mental hurdle as well.
Yeah, that's a great point. I want to say, didn't we see something similar to that in the Super Bowl this year when Odell Beckham Jr. injured his knee? There was another player on the Rams who I think it had an ACL tear, and they mentioned how he went back into the locker room with him at halftime, and basically there was a clear moment of trying to give some kind of counseling and just some kind of being there for him, and so that was a really nice story to see with all this. Do you have a sense of what the youngest we've seen in Achilles rupture in the NBA has been? Because of course it seems like these are happening younger and younger. I don't actually know what the data shows, but it's always surprising to me to see it happen in a college athlete for sure.
Yeah, I'm trying to think, because we've seen a big spike in the Achilles tears over the last few seasons. Most of those guys have been a little bit older. Dwight Powell was a little bit on the younger side, so he might be one of the younger ones that was recent. I'll have to go back and look that up, but it's kind of gotten the gamut of the NBA player. It's gotten the short players like JJ Barea. It's gotten the bigger, tall players like DeMarcus Cousins. So being young definitely works in Moore's favor. It's going to help, line up for an easier recovery for him for sure. I hate it for him that he's not going to be able to play, but hopefully he can return to a high level of play after rehab for sure.
Yeah, definitely. Well, moving on, I know, Jeff, you do a lot of writing for RotoWire, right? And I noticed you put up, was it your first post of the season? Baseball is just right around the corner.
Yep.
I think we've hit on a couple of those guys already in the podcast, but any updates to kind of what we're seeing with some of these baseball guys as the season's getting ready to start off here?
We're still seeing a little bit of the effects of not having contact with the medical staff due to the lockout. So you're seeing a couple guys come in and say, either reveal an injury like we talked about with Chris Sale, or kind of admit that their recovery, like Lance McCullers came in and said he kind of wasn't able to rehab as smoothly as he would have liked for his flexor tendon strain coming off of his injury that in the postseason. So that's been kind of what's dominated, at least for my focus. We'll start to get some bigger names and as drafts start to shake out and things like that. But the big one that a lot of people are talking about, besides Tatis, which we detailed, I believe, in episode 2, so if you want to go back and check that out, you can, is the Ronald Acuna Jr. coming back from his ACL tear. And so I kind of did a deep dive looking at some of the baseball statistics coming off of that, and he's going to be in line. They're going to, thankfully, to the adoption of the new universal DH, he's going to be able to come back and play in a DH role and then ease himself back into the outfield. So they're looking at kind of April and then into May for his return to play. What I'm warning fantasy players about is that initial studies have shown, there was a study that showed when an athlete returns to play is one thing, and then when they return to their previous level of play is another. And so even though the average return to play is about 310, the return to performance is about 23 days longer, so average. So we're looking at basically a 3-week to 2-week recovery window in terms of just adjustment. So getting back to playing at a high level, getting used to doing the things you're going to do. So I'm kind of warning that early on he might have some struggles, but as he progresses and gets further away from that surgery, as long as he doesn't have any setbacks, I think he can return to top form. So the other one I found really interesting is I found a 2015 study that looked at batting average based on what leg was involved. And if it was the rear leg, it resulted in the average player had a dip in their batting average in that first initial year back.
Interesting.
So and that is Acuna falls in that category. So he might struggle a little bit at the plate too. So, maybe not the number 1 overall pick like he was last year, but a guy that we're still definitely considering a top prospect for fantasy purposes and in all of baseball.
Man, that is a deep dive. It's interesting to think about that thing with the rear leg. I mean, it makes sense, right? I didn't play baseball when I was younger, but I mean, I guess that's kind of the leg you're loading and pushing off of, right? Whenever you're swinging.
Yep.
Huh.
And pivoting too, a lot of pivot, a lot of torque going through that. Think of it like a golf swing. That might be, something you're more familiar with. Yeah. Same thing, right? Like, and we talk about a guy like Tiger. We're talking about a guy like Tiger Woods, right? Like, that was one reason why he had so many knee issues, is the sheer amount of torque he puts through his legs. Right. Same with the batter, just a different load mechanism, different approach.
Excellent. Well, you all should definitely make sure you're following Jeff, because he certainly covers a lot more baseball than I do on any of my outlets, and is a great follow for all things related to baseball, fantasy baseball, etc. I want to finish up here, Jeff. We like to take questions from people. I got a really interesting question from on Twitter. Logan Sprinkle is the name of who sent this question. And basically, in the soccer world, Sergio Aguero is a footballer who, pretty famous, was recently kind of forced to retire due to some cardiac issues. And we never really heard for sure what these cardiac issues were, which is often the case. And there's some rumor out there that maybe he's going to try to come play in the MLS, in Major League Soccer. And it kind of made me think about how there's different rules and kind of guidelines in different sports leagues about health and return to play and medical clearance. And there's a couple of pretty good examples of this. It certainly is possible that Aguero could not be cleared to play in one league in Europe, but might be permitted to play in the MLS. Probably the best, most recent example of this that we have to give a huge shout out to, Christian Eriksen, the footballer from Denmark, I believe, who had the cardiac arrest episode at the Euros. He's back playing for Denmark. He's scored twice, I believe. He's back playing in the Premier League. He had a ICD put in. So he had an implantable cardiac defibrillator placed. And the team he was originally playing for was in Serie A, so the Italian football league. And they do not permit their athletes to play with an ICD. However, the Premier League does. And there's no right or wrong to that decision. It's basically just sort of differences in opinion. There's plenty of data one way or the other. And it's the same thing when we see other kind of heart problems like this. We had a similar instance, of course, Isaiah Austin, right? The Baylor basketball player who they discovered he had Marfan syndrome at his pre-draft workouts, was not cleared to play in the NBA, and now he's playing somewhere overseas. So these rules of kind of medical sports clearance aren't international, they're not universal. There's not one set of rules that every sports organization in every country at every level has to follow. And you'll see a lot of variations whenever we go into different sports in different countries. So it definitely is possible. I don't know how true these rumors are, but somebody could have one, a medical diagnosis that permits them from playing in one league or one country, but might allow them to play in another. Any other thoughts with that? I know we've kind of seen this thing come up a lot.
I was going to bring up Austin, and you beat me to it. He went and played overseas. I think he got clearance by his docs to potentially try an NBA comeback as well.
Oh,
so
nice.
I think I saw that. Don't hold me to that. But I definitely, it's an interesting thing we don't necessarily think about, because we always focus on the four major sports here. But there's a lot that goes into playing overseas, and again, different regulations, different restrictions, and those kinds of things. So it'll be interesting to watch. I would love to hear. Hopefully, if he does end up playing again, we start to get some more clarity again to what we talked about earlier, what the situation was, just from a transparency standpoint, so we get a better idea of what to expect moving forward, and maybe what the rules and regulations are of that league that he plays in.
Right. I'd have to say, if I have a severe enough heart condition that I'm forced to retire, I can't imagine I'd be too eager to go back out there and exercise again. But some of these things change. You get different treatment, your measurements, your kind of risk level can change based on treatment and how things progress. And so who knows? But excellent question. We always appreciate seeing those, Logan. So thanks a lot. Well, thanks for listening along, everybody. Any final closing words here, Jeff, as we head into the weekend here, down the final stretch with the NBA season and other things?
Not really. Just more to you, man. Good luck to you and the family. Keep me updated. I'll keep my fingers crossed all goes well, and we're excited for you for sure.
Yeah, appreciate that. Hopefully next week at this time we're back talking, and I've got a little sidekick with me. So I appreciate that, and it's always good talking with you, Jeff. We'll see you later.
Take care.